All right, so again, this is the final presentation for our MIPS series titled Practice Transformation. The agenda for today, we're going to review the first three parts of the series. We're going to just do a brief overview of the concepts that we went over in parts 1, 2, and 3. We're going to dive right into some strategies for MIPS success, and then review a few tools that can help you succeed. And then, of course, at the end, we'll have a little Q&A. There will also be some polling throughout the webinar, so I hope you will interact with us and answer these questions as they come along. So, brief overview of MACRA and MIPS in particular. So MACRA is the Medicare Access and CHIP Reauthorization Act. It was established essentially to rescind the sustainable growth rate formula and also to streamline a few programs, meaningful use, value-based payment models, and the PQRS, or Physician Quality Reporting Systems. It was passed in 2015, but we won't actually feel the full financial effect until 2019. But provider performance reporting has already begun. 2017 was the first performance year. So MACRA is composed of two parts. We have MIPS and then APMs. On the MIPS side, which was the focus for this series, it was essentially a streamline of our meaningful use, PQRS, and value-based payment model programs. And the MIPS scores are based on sections of quality, resource use, and use of technology, as well as practice improvement activities. There is also the APMs, or Advanced Payment Models. A payment model that is considered an APM in which providers assume responsibility for cost and quality performance of service. On the APM side, providers will take on greater risk, but they will also have greater rewards. There is a 5% lump sum bonus provided after the year 2019. Again, we focused on MIPS for this presentation, but overall, the goal of MACRA is really to shift our operational focus from a fee-for-service to a value-based reimbursement setting. So in January 2015, the Department of Health and Human Service announced a new goal of having 30% of our Medicare payments made through APMs, and then 85% of our Medicare payments tied to some sort of value or quality. And then 90% of our Medicare payments tied to value or quality by 2019. So as we can see, our focus is really shifting onto this value-based, quality-focused payment, and Medicare is attempting to do that through MIPS and APMs. So let's focus on MIPS. Who does it impact? MIPS is really impacting in years 1 and 2, physicians, physician assistants, nurse practitioners, and clinical nurse specialists. Years 3 and beyond, the number of providers required to report almost doubles, right? So we're going to also include our PTs and OTs, our speech and language pathologists, audiologists, social workers, and clinical psychologists. So, you know, MACRA and MIPS, we're putting our arms around all of our providers, anyone who's engaged in patient care, and they are now required to report on measures. So what does MIPS look like? What is the process? So the first step is reporting. And if you'll remember in our second webinar, we have to decide if we're going to report as an individual or as a group. Our second step is determining our participation level and scoring. So we have high level of participation all the way down to non-participation as options. Of course, the preference being participating as much as possible to either receive a net neutral or positive payment adjustment. The third step is to determine our weighted score calculation. And for the year of performance year 2017, we have categories of quality, advancing care information, and clinical practice improvement as part of our weighted score. The fourth step is comparing our scores to our peers. This is a net neutral, budget neutral, I should say, program, which means that the winners will be taking money from the losers. In essence, the bonuses that the winners are receiving in positive payment adjustments are coming out of negative payment adjustments from those providers who do not perform well. And then step 5 is calculating the final payment adjustment. So we've finished up the 2017 performance year, and that performance year will actually impact the 2019 fiscal year. So in 2019, providers will either be categorized as low, average, or high performers, again, comparing against each other. So if a provider is categorized as a low performer, they're going to receive a 1 to 4% payment cut. If they're an average performer, they may be net neutral or receive up to a 4% bonus or positive payment. And then if they're a high performer, they're going to receive 4% or more, depending on the bonus money that's available. So because there is only one pool of money, maintaining budget neutrality is of the utmost importance for this program. And as a reminder, you have to report by March 31st of this year in order to avoid penalty for 2019. So to reiterate, your 2017 performance must be reported by March 31st, 2018 in order to avoid your penalty in 2019. So what do the payments look like moving forward? In 2020, there's going to be up to a -5 or +5 payment adjustment. In 2021, bumping up to 7%, and then in 2022, 9%. So these numbers jump pretty quickly, and cannot stress enough that the providers who are earning additional money are taking that money from the providers who are not earning the money. So there is real chance here that Medicare reimbursement will be cut. So in order to calculate your payment adjustment, again, we've got penalties or a negative adjustment. We also have a positive adjustment with the potential for a bonus based on the bonus threshold. CMS reserves the right to set the threshold. For 2017, they've set the performance threshold to a very low value of 3. Basically so that avoiding a penalty is relatively easy for this first performance year. They've actually set the exceptional performance threshold to 70, so that's very, very high. So it's most likely that in this first year, providers will experience a neutral or hopefully slightly positive payment adjustment. But again, they're arbitrarily setting that threshold this year. In 2018, it's going to be a true determination of provider to provider. So let's break down the scoring methodology as we just did in part 3 of our series. As I mentioned, in 2017 performance year, we have 3 categories that are weighted. Our quality, which is most heavily weighted at 60% of our score, advancing care information at 25%, and then clinical practice improvement at 15%. And your scorecard is going to be broken down as you see on the right. You will be assigned raw points out of a total possible point value. It's going to be multiplied by the weight, which then converts into your MIPS composite score. Each category of your score has the opportunity for you to earn additional bonus points depending on the category. So as you can see in the quality category, you have to do the measure requirements, and then there are optional bonus points. In the advancing care information category, there is a base score plus a performance score, and then additional bonus points available. And then finally, in the clinical practice improvement category, it's essentially whether or not you do the activity, and each activity is given a weight. So let's jump into some strategies for success. First thing is reviewing your QR/UR. So we mentioned this at the very end of part 3. The QR/UR is essentially going to become your MIPS performance feedback report. So if you have not looked at your QR/UR yet, that is the first strategy. Review your QR/UR. So the structure of the QR/UR is as is on the screen. The value modifier is essentially what will become your MIPS score. So we can think about it like that. The value modifier in your QRUR report is broken down into two composite scores, your quality composite score and your cost composite score. And then within each section, quality and cost, there are domains essentially that you are scored on. So let's take a look at this and compare it to how our MIPS performance report may look. So under the quality category, you're going to have clinical care effectiveness, patient experience, patient safety. Those are all going to go into that quality bucket for your MIPS performance. And again, that's weighted highly at 60%. Then your care coordination, efficiency, and population health, those domains that are under the quality composite score and the QRUR will show up in the clinical practice improvement section of your MIPS performance report. And then under your cost composite score, that will be resource use. So this is just sort of an estimation of what a QRUR in parallel would look like with the MIPS performance feedback report. We have no idea what the report is actually going to look like, but CMS has given us good indication that the QRUR will be extremely similar. And we can get some good information at looking at your practice's existing QRUR to know sort of where you stand against the national and regional physician average, and also to pinpoint areas where your practice could focus on some improvement. Here's some steps for how to access it. If you've never accessed your QRUR before, highly encourage you to do so. So you're going to go onto the CMS portal, enter various IDs, and then go ahead and select the PQRS option on your portal screen. Select the year. I would recommend you look at the last two most recent years for your QRUR to sort of get a good trending idea of how you've been doing over time. And I also want to mention here that there will be a cost category on the QRUR report. Cost is going to be extremely relevant for this performance year in 2018. It is not, however, measured in the 2017 performance year. So resource use or cost will not be a component of your score for affecting 2019 payment, but it will become relevant this year in 2018. So we're going to take a brief break here and do a quick poll. So I'm going to go ahead and launch this poll. When did you start or plan to start reporting quality measures for MIPS? So if you've already started, if you're planning on reporting for 2017, go ahead and select 2017. If you are hoping to start in 2018, let us know. And if you haven't started yet, that's okay too. Give everyone another 10 seconds or so to respond. All right, we have a very engaged group. We have 100% who have already started reporting quality measures for 2017. That's awesome. Awesome, awesome. I'm happy to hear that. All right, so what's our next strategy for success? We're going to review our QRUR, and we're also going to identify our EHR capabilities. So the electronic health record has really become the center of a lot of these programs. So first and foremost, does your EHR basically support you in this MIPS journey? And there are 4 things that we believe are really essential in order to succeed. So documentation, quality measure reporting, having a patient portal that is functioning and accessible, and then also dashboard reporting. So let's break down each one. So the first thing is documentation. Key questions to ask to make sure that your EHR meets the MIPS documentation needs. Number 1, are your templates set up to capture quality measures in a structured data form that can be reported, right? So now we need to know, does the patient get their flu shot? And also we need to make sure that when we run a report out of our EHR, that flu shot is captured. It can no longer just be, oh, the physician put it in the free text box under the HPI section. That's good enough. We need to make sure that it comes through in a structured format. Second question, does your EHR offer appropriate diagnosis and CPT code capture? right? We want to make sure that we're capturing all of the diagnosis codes that are relevant for the encounter. I know the drop downs that exist in EHRs can be time savers, but can also be sort of iffy when it comes to making sure that we have specificity and that we're documenting all codes appropriately. And the third question is, do users have the necessary access to document in accordance with HIPAA? So we have some advancing care information measures that we have to meet, including producing a security risk analysis. So we want to make sure that we have a compliance plan, that we're acting in accordance with all of the meaningful use measures, and also that users who are documenting these quality measures have the access to do so. So it may not always be the provider that's entering that flu shot, but can the MA enter the flu shot in the field that then gets pulled out in the final report that will be submitted for your MIPS measures. So hand in hand with documentation is quality measure reporting. So key questions to ask. Does your EHR vendor submit your quality measures for MIPS on your behalf? So this is a big deal. If your EHR measure does not, then you're going to need to find an alternative method for submitting your MIPS measures. And can you pull measure reports throughout the year to check on progress and anticipate your score? Part of success in MIPS, or really in any measurement program, is trending over time, tracking your progress, making sure you're meeting goals along the way throughout the year. If you can't measure your progress, how do you know where you need to refocus your efforts in time to successfully submit, right? So we want to make sure that our EHRs not only can capture the data through proper documentation, but then can also report easily, and those reports are accessible and viewable by management throughout the year. So the next step is the patient portal. So key questions to ask. Does your EHR offer a patient portal, right? That is one of the advancing care information measures. And in addition, it's just become good practice. A patient portal allows patients to view their health records on their own time. It will often save you administrative time because they can go in and update their demographic information. They can pay their bills, so that gets you paid faster, which is always a good thing. And they can communicate with their physician. So a patient portal is absolutely crucial. If your EHR does not offer a patient portal, there are alternative vendors that will link externally to EHRs, but definitely a patient portal is essential. And then, hand in hand is, can your patient access their encounter summaries, their lab orders, their appointments, and their billing information? The more information the patient can access, the more efficient your office can run. So not to mention the fact that you get credit for it in your advancing care information category, but also it's just good practice for running an efficient and optimized system. Finally, dashboards. So I like to think about a dashboard as a pretty picture that reports just can't quite give you. So when you pull a report, a lot of times it'll download into a tabular format. A dashboard is something that is interactive and that can help you visualize your data. So does your EHR offer a dashboard that updates regularly? Can you see at first glance, quick snapshot, Dr. Smith has completed 60 out of his 70 flu shots for the patients in the past month? Can you see that? Can you click and drill down and identify the patients who have not received their flu shots? You can go back and try and collect that information in order to complete the measure. And can the dashboard integrate data across providers and practices as needed by the medical group? So if you're working in a big system, you need to be able to see all of your providers all of the time. Or even if you're working in a smaller system and you have multiple practice locations, if you want to slice and dice the data, you want to make sure that your data is fully integrated and you have access to stratify by provider, stratify by specialty, stratify by location, or any way you need to see it. Because as these quality measures become more and more important, it will be increasingly essential that your system work together to capture all of the information. And the only way to know if we're capturing the information is if we can report on it. So that's where the dashboard really comes in handy. The last strategy for success is solidifying your HIE or Health Information Exchange and registry connection. And there are two reasons for doing this. Number one, it is an advancing care information measure. So advancing care information is so important that if you do not attest to the advancing care information measures, you have no opportunity of earning any points in your MIPS score. Okay, so advancing care information, you can think about it like the foundation. If you don't have it, the house can't be built. So you need an HIE connection in order to pass the advancing care information category and qualify, basically, to be rated against other providers in your MIPS score. The HIE allows you to send a summary of care. It will allow you to do public health and registry reporting, and it will also provide you with a level of data access that can be useful in managing your patients, and thereby getting us to the second reason, which is improving clinical quality. The more information we have on our patients' health needs and health whereabouts, the better we can coordinate care, manage care. We can help to identify those high-risk patients and get the access to the information we need in order to practice at a high level. So very important to have an HIE and registry connection for the reasons of, number one, meeting the MIPS measure, and number two, practicing high quality care. So let's take a quick break for another poll. All right, which of the following is a benefit of a health information exchange, or HIE? And our choices are improvement in quality and safety of patient care, reduction in medical errors, a decrease in duplicate testing, or all of the above. All right. Awesome. The answer is all of the above. Most of you got it right. So again, we're looking at making sure that our patients get highest quality of care. An HIE or registry allows us to access information that may not be in our EHR, but may be in the patient's medical record. Great. All right, one more strategy for success here. Intentional quality measure capture. This is so important. When we think about capturing quality measures, we're not just checking a box in the EHR. Often it is more complicated than that. And often we have providers whose schedules are so tight that we need to help them capture these quality measures by putting systems in place in our offices so that they can be captured effectively and smoothly, and it just becomes part of the flow. So here's an example for a flu vaccine protocol. The patient will arrive at the front desk and check in, and then the front desk will say, do you want to get the flu vaccine today? If the answer is yes, then a medical assistant can administer the vaccine right away with a standing order. They will enter the information into the EMR so that the quality measure gets captured, and then the provider sees the patient, right? If the answer is no, patient does not want to get the flu shot, then the provider is going to go ahead and see the patient as normal. And again, we're going to have another opportunity. The provider is going to encourage the patient to receive the vaccine. At that time, if the patient does want to receive the vaccine, then the provider can instruct the MA to go ahead and administer the vaccine. The MA is going to enter the information into the EMR, and then checkout will happen as normal. So you can see here we're leveraging a medical assistant to both administer the vaccine and also to enter the quality measure. We're also protecting the provider's time so that we're only using his services if we need to convince the patient or encourage the patient to receive the vaccine. So what are some tools that can help you succeed? We have Beacon Reports. This is a comprehensive tool for practice management. It qualifies as both a qualified registry and an attestation. It can collect data to report across multiple EMRs and management systems. And it's comprehensive, interactive, real-time data reporting. This is one of those dashboards that once you have, you won't be able to live without. The great piece about Beacon is that it can integrate multiple systems. So if you're working in a medical practice or medical group where you have multiple EMRs, which many of us work in those environments now, it can integrate all of those into one reporting system, which is an incredible time save and also just accurate and correct data reporting. Another tool that can help you succeed is an EHR optimization. So we all know more time spent on the computer, less time with the patient leads to frustrated providers, frustrated staff, frustrated patients, long wait times, an inefficient office workflow, and quite frankly, lots of errors in documentation. We want to get more time focused where we need it. So what can an EMR optimization really do for you? It will help you review the existing policies and procedures, an interview with managers and administrators and also support staff can allow for insight when visiting practice and observing workflows. The interview of staff and also providers allows us to review the templates, identify shortcuts and struggles with the EHR, and then document observations. The process maps will then allow an evaluation of a current process, identification of gaps, and to determine any changes we might have, we might suggest for your workflow. And then it helps also to just have elbow-to-elbow support with those providers who are working day in and day out with this EHR, and most likely have more questions than not. All right, we have the final polling question. Before we get to that, actually, I'm going to pause for any questions. Again, feel free to chat them in the group chat box. Your chats will come directly to me. I will give a few seconds for some questions to come in. All right, so we have one. We have already done an EHR implementation. What is the difference between an implementation and an optimization? That's a great question. So during an EMR implementation, generally it's just the EHR vendor, and they come in and they implement various templates and they get you started on your EHR. The optimization is a chance to look at both your practice workflows and your technology workflows. So an optimization really enhances your ability to make the processes more efficient, to design the templates so that they are customized, and also to make sure that your providers are functioning in a space and in a system where they feel they can be the most productive. Okay, it looks like we have another question here. What type of population health dashboards does Beacon Reports offer to support MIPS? Another great question. So the population health dashboards in MIPS, in Beacon Reports, excuse me, offer customizable quality measures. So what that means is inside of the reporting engine, you will define a measure with a numerator and a denominator, and Beacon Reports will track that measure for every provider. And what that allows you to do is essentially be confident that, number one, you're documenting the quality measures so that they are easily reportable. And number two, it allows a qualified registry to then go ahead and submit on your behalf for MIPS. So you can use this specifically for MIPS, or let's say you're engaged in another value-based contract where you have quality measure reporting. You can define custom quality measure variables, and then you can track your progress on a real-time basis across all of your EHR systems right there in Beacon Reports. Any other questions? I will leave the chat open for some more questions. And in the meantime, I'm going to go ahead to the final poll because I'd really like everyone's insight on this last question, which is, what free webinar series would you be interested in next? We really enjoyed doing this MIPS series. We hope it was helpful, and we would love to know what you're interested in hearing next. We have some thoughts deconstructing Medicare preventative service codes, value-based payment models, and contracting. And that would be both physician and payer contracting. So I'll leave that open for a little bit. And in the meantime, I will leave the chat box open. And we hope you enjoyed the series. We'll send out a brief survey. And of course, the recording of the webinar will be posted on the website later this afternoon. Thank you all so much for joining us.